Well, good to have you with us here on the Friday edition of the South African Morning. About an hour and a half left here on the show. Such a big day for us. We're talking tourism and we are talking vaccinations. Both of those numbers, we need them to go up, don't we? But we also need one other number to come down. That's going to be the COVID-19 numbers. I'll tell you why it's such an important day for us. Gauteng Premier David Makhura and Health MEC Nomathemba Mokgethi visiting a pop-up vaccination site in Sedibeng. So, normally with me here on the show, of course, my co-partner, if you will, Tumelo Mothotoane, out at this drive-through, walk-through vaccination site. Tooms, morning. I mean, I was taking a look at when you were doing that little bit of a walk around earlier. It really looks like we've got these vaccination centres waxed. It's very clearly marked. It's very clear where everybody needs to go, isn't it? It's very, very well set up.
Absolutely, Gareth. And just before then, I mean, I had a conversation with Senata Sejake from the Sedibeng District Health Services. They were not too happy with yesterday's turnout. Approximately less than 200 people or so came to the pop-up site. But they're saying today and tomorrow is another opportunity for you, if you are in this region, to come and get yourself vaccinated. But first, Gareth, I just want to make note of the walk-ins that we are seeing right here at the Vaal University's Isak-Stale Stadium. Of course, people have been coming in trips of drabs, but definitely because it's still morning, it's a bit cold, they do have some time to try and get themselves here and get their jab. But also we know that it's not only the walk-ins that they will be accepting, the drive-thrus as well will be expected today. And of course, they'll be making their way then into the entrance where they will get their jab. That 15-minute window period is still crucial for healthcare workers to ensure that there's no reaction to the jab. But also, we understand, as you mentioned earlier on, Gareth, that Premier David Makhura, as well as MEC of Health, Nomathemba Mokgethi, will be doing door-to-doors in the area, also visiting this pop-up site to ensure that everything is running smoothly. So we'll be, of course, monitoring all of that for you and just making sure that you understand where you need to be this very morning if you are trying to get yourself vaccinated. Remember, we are here because of the low uptake, we understand, in terms of the numbers of people coming to get themselves vaccinated. But equally important to note is that I'm joined right now by a very special guest, Dr. Mary Kaunga, the chair of the Premier Advisory Committee on COVID, just to give us a bit of a consensus of what to expect, what they're seeing, what the data is showing them within the province in terms of infections, as well as the vaccines and some of the strategies they have to ensure that they effectively fight against COVID-19. Doc, good to have you and good morning to you.
Good morning, and thank you for having me.
It's a pleasure to have you, Doc. And I suppose this conversation is so important at this pop-up site because you have the data as the advisory committee in Gauteng in terms of how Gauteng is doing, how it's doing in compared to at least last year, and what strategies you are putting in place to ensure that you have an effective fight against this pandemic. Let's compare this year to last year. How is Gauteng generally faring in terms of infections, would you say?
Thanks for that question. I mean, I think Gauteng has just gone through quite a severe third wave, as we all saw. So I think if you had to compare this year to last year, I think we were battered quite a lot in a few months ago. But the good news is we're over the third wave. The peak was in July. The numbers are down. So the daily new cases, 7-day rolling average of new cases are down. The deaths are down. And the percentage test positivity, which gives us an indication of how widespread community transmission is, that's also down. But what we're cautioning the public is that even though Gauteng is now in a much better place than we were a few months ago, the rest of the country is still in a third wave. And I think it will take a while for things to settle down in all the other provinces.
Yeah.
So some of our neighboring provinces like the Free State and the Northern Cape, the numbers are still quite high and they're not yet stabilized. KwaZulu-Natal was also still not quite stable. So we're still waiting. I think it will take a couple of weeks or so before the rest of the country comes to the position where Gauteng is. So at this point in time, what we're really encouraging the population is to continue with the non-pharmaceutical interventions, wearing masks, sanitizing, avoiding crowds, and most importantly, to vaccinate. So vaccines save lives, and I think that's why the Department of Health, the Gauteng provincial government is pushing, trying very hard to get vaccines out to people. So they're setting up sites like this to encourage people in the neighboring area in this region of Sedibeng to come and vaccinate, because that's one of the biggest interventions that will help us keep the fourth wave as low as possible.
Right.
Yeah.
Doc, two things you mentioned there that I appreciate. The first being that Gauteng is not in isolation of other provinces. We know that there's a lot of movement and traveling in and out of Gauteng.
Absolutely.
We have to be cognizant of those who've left families and loved ones in other provinces, come to Gauteng to work and vice versa, because that could be a cause of transmissions from interprovincially. But the second thing being awareness around, COVID-19 and vaccines. And we know that part of vaccine hesitancy is fake news, misinformation, but also not getting the adequate expert information around the importance of vaccines. How important is this pop-up site for this particular community?
I think this pop-up site is really important for this particular community because I think it's easy access. Because one of the things about trying to understand the reasons why a high number of people are not yet vaccinated, part of it is perceptions, how people feel about the vaccine, what they think the vaccine is and how it works or doesn't work, etc. And some of that fuels some of the hesitancy because some of the information people get, as you correctly said, is incorrect. Some people have legitimate concerns about the safety. And so I think opportunities like these are not only for people to get the jabs, but they're also health workers here who can provide information to people who want to know more about the vaccine and to be reassured that it's actually safe and that it works.
Yeah.
And but the other issue, apart from trying to allay people's anxieties and giving them information, is that making vaccines accessible, in other words, easy to reach. So having pop-up sites like this in a neighborhood like this means a lot of people in this area can easily even walk to get their vaccination. And I think also hopefully the people who will vaccinate today will be able to go and tell their friends back home and their families to say, look, there's a site close by, why don't you come? Yeah. And the reason why the Gauteng Health Department is doing this is it's pop-up sites like this is we feel as if we're racing against time. The fourth wave is looming.
Right.
And we want to vaccinate as many people as we can before the fourth wave hits. Because I think if we can vaccinate a high proportion of people, then the negative consequences of COVID will be less. Hospitalizations, deaths. The evidence from South Africa as well as other countries shows that vaccines reduce significantly the number of people who end up in ICU, in hospital, and the number of people who die from COVID-19. So that's our ultimate goal.
Yeah. Doc, with that being said, with the efforts that we're seeing, and you were mentioning there how, pop-up sites such as these also assist with it being more accessible. I mean, I think a 5-kilometer radius is what we're looking at for those who are living in and around this area, quite mobile for you to get here. But also I see the Department of Health going the extra mile and doing door-to-doors, trying to assess those who are even eligible to get the vaccine, 18 years and older being the age. But with that being said, Doc, I can't help but wonder if these new variants that we keep learning about, and it's probably normal in a pandemic to see different variants mushrooming out.
Yeah.
To what extent do those pose a challenge to these efforts that you are making in terms of speediating, not only your fight against COVID, but also in terms of vaccination campaigns? You're dealing with hesitancy, but at the same time, then there are new variants and there are questions around whether these vaccines will even be effective in combating these new variants.
Yeah, thanks. That's a good question, and I think it's an important question because, as you correctly said, there are a number of variants out there and we keep hearing about them. So thankfully, the one that's dominant still in South Africa and in Gauteng is the Delta variant. And we know the vaccines we're using in our program in this country, both the J&J and the Pfizer, are effective against the Delta variant at reducing both hospitalization and death. So that's the good news. And so what we're trying to do, so that's the other reason why I'm talking about race against time. If we want to use the vaccines that we know work against Delta as quickly as possible, because we don't know what other variant might show up and how well it will respond to the vaccines that we have. So that's the one thing. And the other thing about vaccination is that it also will help to reduce transmission of the virus. And usually variants come up the more transmission there is. And so if we can reduce that, it will also help reduce the emergence of new variants in our population, in our community. And so that's the other benefit of vaccinating, and vaccinating as quickly as possible, a high proportion of people. Yeah, absolutely.
Absolutely. And you know what, as you continue with your efforts, we're going to leave our conversation then. Thank you so much for joining us. Dr. Mary Kaunga, part of the advisory committee, ensuring that in Gauteng, you know, there are strategies put in place, Gareth, to ensure the effectiveness of the vaccination drive. But as mentioned before, we are still here at the VUT's Isak Stadium. Quite, you know, interesting that it's in a university, an institution of higher learning, where we know that those who are 18 years and older can also get themselves vaccinated, making it accessible for the youth as well and the students community to also come and get their jab. But also just a reminder that if you are in the area and you missed yesterday, there's still an opportunity today as well as tomorrow to come to this pop-up site, and those walk-ins of course still happening, and the drive-throughs in ensuring that of course you make use of this jab. But of course, as mentioned a bit later on, I expect to have a conversation with the Premier, Mr. David Makhura, around the walkabout they'll be doing, Gareth, around the region. Not himself alone though, joined by the MEC of Health, that's Ms. Nomathemba, Mokgethi, and they will be going door to door to try and bring the vaccines to the people, and also says those who are 18 years and older or even eligible to get the vaccine, and ensure that they do get their jab. Back to you in studio.